All right, so for this discussion, we're going to talk about modern Homo sapiens. It's sometimes abbreviated as AMHS, anatomically modern Homo sapiens. And so these individuals arrive first in Africa about 200,000 or so years ago. The timing is debated, maybe pushed as much as 250. I've seen some things in print as much as 300, maybe 150. So we'll keep it easy. 250,000 years ago, appearance of anatomically moderns in Africa. For about half of this time, they stayed in Africa, and about 100,000 years ago, they left and then moved throughout Europe and Asia into Australia. Australia maybe as early as 75,000 years ago, for sure 50,000 years ago, and then moved into the New World, into North and South America, maybe as early as 25 or 30,000 years ago, for sure by 15,000 years ago. So, what are the characteristics that differentiate anatomically moderns versus archaics, for example? So, as the debate, Neanderthals versus moderns, what do we have that Neanderthals did not? So as I talked about when I was talking about archaic Homo sapiens, the first two things. Neanderthals have a very low sloping forehead, and Homo sapiens, anatomically moderns, have a more prominent, taller, more rounded forehead. So this is one of the things that we will pay attention to. The second part is the chin. So remember when I was talking about Neanderthals, I talked about the fact that the chin is receding, whereas with modern humans, the chin is projecting. So that's one of the things that we will pay attention to with anatomically moderns versus archaics. Tooth size is smaller. And so with moderns, even with early moderns, the tooth size is much smaller than we see with other hominids. And associated with that comes a decrease in prognathism. And so even with the early forms of anatomically moderns, there may be more prognathism than we see with most recent individuals, but still we have a flat face, and that is associated with a decrease in tooth size and the chewing musculature all around. Especially when I was talking about gracile and robust Australopithecines, I talked about post-orbital constriction, this pinching behind the eye orbits that's associated with the musculature for the muscles of the face and jaw. And with anatomically moderns, there is virtually no post-orbital constriction, and at the zygomatic arch, there is it's quite small. And so again, this is a small difference between archaics and us, but it's a dramatic difference between us and our earlier hominid ancestors. And so especially when you look at the skulls of moderns from the top versus the skulls of other of our ancestors, there's very little pinching. There is a decrease in other strong features with other individuals, like the brow ridges become smaller. And with modern, like recently within the last few thousand years, the brow ridges have become even smaller in anatomically moderns. This is a cast of an anatomically modern from about 30 or 35,000 years ago from Central Europe. And so yes, strong brow ridges than what we're used to, but still much less than our ancestors, but a strong prominent chin, large forehead, and so the increase in brain size is more up instead of back. And so the overall shape of the skull is a little bit different, right? So it's not as long, it's taller, and you see more. If we look at sort of the ratio of how much skull there is versus how much face there is, it's changing. And something that I also talk about is if we look straight at a modern human versus a monkey or the cast of one of our earliest hominids, if I look at, with having to take my hand down, how much of the entire face, when you look at an individual, is above the eyes versus how much of the face is below the eyes. And with modern humans, with this increase in the forehead shape to have the higher, more rounded forehead, there's an increase in how much of the face there is like above the eyes.